Hi, and thanks for joining us today. My name is Casey Stratton. I'm the VP of Clinical Personnel.
Hi, my name is Dr. Matthew Peterson. I am a board-certified anesthesiologist, and I'm the Chief Medical Officer here at Elite Anesthesia.
And we are excited to talk to you today about how you can improve your practice via office-based anesthesia.
We want to help you take care of your patients the way you would expect and the way they deserve.
One of the first things we're going to talk about today is issues affecting dental practices and treatment plan acceptance.
The next thing we want to go over with you is what you can expect from an anesthesia provider, from any office-based anesthesia.
Another thing is, how do you talk to your patients about sedation? How do you bring it up as an option? If it's something you've never done before, it can be a little awkward in the beginning. We're going to talk about some tips and tricks of things you can say to bring up sedation as an option.
Last is what you can expect from Elite Anesthesia as we bring all of those opportunities into your office and can really help you with that.
Ultimately, our goal is to increase your patient satisfaction within your office. We know that 5-star reviews are driving clients and patients to come in and see you specifically. So by providing that extra service, we can help increase that patient satisfaction. Take this into consideration. You have a patient that has a lot of work that needs to be done, but whether time restraints or anxiety restricts them to doing certain things once, waiting 2 to 3 weeks, doing the other set, waiting another 2 to 3 weeks, and doing another round of dental work. That just sounds daunting to patients. What a hard sell for you guys in your office to get somebody to accept that type of treatment plan. Well, what we propose is presenting them with an option of being asleep, sleep dentistry, doing all of the work while they're asleep in one stop. A funny example I want to bring up, our marketing director, Court, actually had a broken tooth. And granted, he came to us because we know all of the great dentists that are in the area. We referred him over. He went into the dentist and was talking about his broken tooth. This dentist then was saying, yeah, we could probably cap it, but you might be able to get away with 6 months to 12 months before it actually starts hurting you I'll do that cap for you for $800. So Corey was trying to think and decide whether he wanted to get it done now or wait 6 to 12 months, went up to the front desk to check out, and the front desk said, well, that's going to be $800. He's like, well, $800? It was just a cleaning today. They're like, oh, well, don't you want to schedule that cap? He's like, I haven't even thought about that all the way, and ended up walking out of the office. I want you to think about how much production is walking out of your office because of the presentation that you're giving on these treatment plans. Consider the scenario that this dentist sat down and said, Court, we can do this for $800. Or we could provide sedation, get you all the way off to sleep, keep you comfortable for an additional cost. But then on this other side, you had 2 or 3 cavities we could take care of at the same time. So now you're presenting them with an option of one treatment plan with sedation, one treatment plan without sedation. You're not saying, do you want to do this? Yes. Do you want to do this? No. You're giving them 2 viable options that they can then choose from.
A lot of times when you bring a patient into your office, you have a treatment plan that needs to be done, but this patient maybe is a little bit more complex. Maybe they have a lot of medical problems that are just tough for you to manage on your own, even under a level of sedation if you're able to provide that sedation. So being able to have an anesthesia provider come in who can take care of the sedation. So all you really need to work on is taking care of that plan. They can take care of the sedation, whether it be from a monitored anesthesia care all the way through general anesthesia. They can take care of that. You can just focus on the work. The next thing is I don't want you to feel like you need to refer out these difficult cases. Going back to what we were saying before, some patients have a difficult medical history. But as you can see on the slide here, this is our pack out that we bring in that contains everything that you would expect in an anesthesia cart in a hospital. Everything from emergency medications, an AED, emergency airway equipment. So we're able to take care of your patient in the best way that you would expect, whether you were in a hospital setting or in your office. That sedation should be the same. You should be able to feel confident in taking care of your patients on their availability. We all know how busy everybody's life is. We want you to be able to schedule your patients and say, okay, yeah, we can take care of your patient next Tuesday. And then you can call the anesthesia provider and know that that availability is going to be there. The next point I wanted to go over is your ability to grow your practice. Being able to provide sedation dentistry or IV sedation in your office adds a huge benefit to what you can provide. So you can put that on your website, and patients who are looking for that, you now are able to have those patients come and you can give them care, whereas otherwise they'd be going somewhere else. So you're able to grow your practice in that way. As we talked about a little bit before, reviews are important in our day and age. And so for you to be able to get a 5-star review from someone because you could give them sedation will go a long way in attracting new patients. So we want you to be able to feel like that's an option and like those patients are going to come to you because you can know that they're going to give you good reviews. The last thing that goes along with that is the confidence to know that your patients are going to be taken care of in a way that they want and in a way that they expect. Sure, there are some patients who are able to be taken care of under local anesthesia or just awake, but there's others who really need sedation at various levels. Some light sedation, but there are those who need general anesthesia. We want you to be able to feel like you can take care of all of those at any level, at any type of sedation.
Now let's go over some options of how to approach sedation into your treatment plans. Talking to them about the benefits, obviously, because once they decide to go with sedation, your life becomes much easier. One point that a lot of providers bring up is the safety in having a second provider there. So rather than giving a B+ service on the dental work and a B+ service on the sedation, you get to give an A+ service on that procedure, and we'll give the A+ on the sedation. We've seen this over and over again that once sedation is involved, especially with the secured airway, these procedures go a lot faster. You're not having to deal with breaks. You're not having to deal with a talking patient. You're not having to deal with them being uncomfortable and having to re-numb multiple times. This is a one-stop shop where they are asleep, they are comfortable. You start your procedure from A to Z and finish the day. Another great advantage to offering anesthesia in your treatment plan is to be able to add on additional items that they may not want to combine. So, for example, if you had somebody who came in because they needed a root canal, the pain is what got them there. Once you did your exam, you noticed that they had a bunch of work that needed to be done on the other side as well. When you offer them that sedation option of, hey, we have to take care of this root canal. While you're asleep, do you want us to take care of X, Y, and Z? You'll find an increase in that treatment plan acceptance, especially in those add-on items that they didn't necessarily come in specifically for that. You know, it is one of our goals at Elite to make sure that every patient knows they at least have the access to sedation for their dental work. A lot of times these patients put on a brave face. They don't tell you how anxious they are or worried about getting dental work done, whether that's extractions, implants, crown placements. Just by offering them that option, you don't have to assume that they're anxious, but letting them know that you want them to know that they have this option available. It actually comes out as a point of caring. You truly are caring about their comfort level. You know, it is funny to think of some of the hesitation of offering sedation to your patients. However, I want to let you know we have done hundreds of cases where we have come in to sedate patients for simple cleanings. Anxiety is a huge factor in patients delaying treatment. They typically won't come in for a long time because of anxiety. So to be able to offer them an option of being comfortable during their procedure is only going to increase their satisfaction and the likelihood that they'll return when they need to. Being able to provide dental anesthesia coverage across the nation with hundreds of independent providers, we have been able to establish 5 points of excellence. These 5 points of excellence are used across the board. Each time you have one of our providers in your office, there's certain things that you can expect and know will be taken care of. These 5 points of excellence are very important to us, and you may have actually heard of these already in other conversations you've had with us. And now let's play a little video that discusses those 5 points of excellence a little bit more, presented by yours truly.
When we come into your office, you can expect the 5 points of excellence from Elite. These 5 points of excellence are surrounded by being friendly, attentive, and professional. The first point of excellence that we focus on is giving every one of our patients a preoperative phone call the night before. We want to introduce ourselves, let them know who they're going to be dealing with and who will be providing their anesthesia the next day. We'll go over any additional questions, remind them of the MPO status, and discuss any concerns that they might have beforehand. The second point of excellence with Elite is to have a clear introduction not only to the patient and their family, but to the office and the office staff. This includes the doctor, the front desk, and the assistants that might be helping. Establishing that rapport with everybody allows an open field of communication. The third point of excellence is a simple one, but one that's very important to us, and that's arriving early. We want to arrive to your site, be set up, and available to start at the scheduled time. We don't want to be the cause for any delays in your schedule that day. The fourth point of excellence with Elite is having a proactive approach to the anesthesia. This requires attention to detail, strong communication with the provider, and all the necessary equipment to appropriately do these cases in office. And the fifth point of excellence with Elite is very important, and that's a post-op follow-up call. Not only are we going to take care of them from start to finish, but we'll do a follow-up call that evening to make sure that they're feeling okay, address any concerns that may be anesthesia related.
We've been in hundreds of offices across the nation. Each one is unique and different. You can see the QR code in this slide. Scan this and we can have somebody reach out to come visit your office or talk with you about the setup in your office, what needs you're looking for, and how we can help you. I hope this has really helped you understand a little bit about how sedation can help you in your offices. Help you personally, but also help your patients. Thanks for watching today.